Hello, Sofwave providers. Thank you for joining us today. I'm Jennifer Fox, your clinical educator from the Northeast region, and together with my team of nurses, we bring to you the Precise Applicator. Sofwave has ongoing innovation, and we've brought new indications to the market recently. The Precise Applicator is our newest development, offering the same technology in a smaller footprint. This will enable you as the provider to treat smaller and potentially harder to reach cosmetic zones with precision. If you recall, Dr. Eckhouse and our R&D team developed Sofwave with the perfect storm of depth, time of exposure, temperature, and coverage coagulation. Depth is fixed at 1.5 millimeters in the collagen, elastin, and HA-rich mid-dermis. Sofwave reaches average temperatures between 60 and 70 degrees Celsius, which allows for denaturation and coagulation of tissue. The time of exposure to ultrasound heat is 4 seconds, with built-in cooling protecting the epidermis and encouraging the thermal zones to remain at a depth of 1.5 millimeters. The volumetric and directional coverage resulting from thermal coagulation can add up to 42% coverage when delivering 3 passes in one treatment. The directional coverage parallel to the skin surface allows for regeneration of new dermal tissue along the natural vector lines of skin tension. As a brief review of our lift applicator, you see 7 transducers, each of which measure 1 millimeter by 5 millimeters. This applicator is now best used for skin laxity on cheeks, neck, and submental area, and body areas treating the appearance of cellulite. This is our new Precise applicator, boasting 3 transducers, again, each of which measure 1 millimeter by 5 millimeters. This applicator is best used for treating the periorbital area outside of the orbital rim, perioral treatment areas, and can be used for more difficult contact areas on the jawline and on the brows and forehead. I will stress to ensure understanding, neither Sofwave applicator is to be used inside the orbital rim. When treating around the eyes, please only use Sofwave on bone or outside of the bony orbital rim. Now let's prepare to connect the new applicator to the console. Notice on the top right of the home screen, when the lift applicator is connected, you'll see the lift icon here. You do not need to turn off the console to accomplish this change. First, raise the lever, gently remove the connected lift applicator. It's a good idea to place this in its protective case. Now, gently line up the Precise applicator to the console, insert and secure by lowering the lever. You should now see the Precise applicator icon on the top right of your treatment screen. The treatment protocol does not differ from treating other areas of the face. Sofwave is best used for mild to moderate skin laxity, and we suggest the same protocol and pass pattern for the Precise applicator as with the lift. Remember, no overlap from pulse to pulse, no stacking pulses, and please use a 50% overlap from column to column or row to row. It's good to consider prophylaxis with patients stating a history of recent or recurrent localized skin infections in these cosmetic zones. Some suggested energy settings for the forehead, perioral, and jawline area are 3.4 to 4.0 joules, and lower energies such as 3.2 to 3.4 joules on thinner skin areas may be with periorbital treatments outside the orbital rim. Please allow the introduction of Amy, our lovely live model, who has graciously agreed to be our demo patient for today. So let's demonstrate placement of some periorbital and perioral pulses. Always use a sufficient amount of clear ultrasound gel and maintain moderate to firm pressure for good contact from tip to skin. It's always my recommendation to work from the head of the bed, starting at the inferior aspect of the chin and using ultrasound gel and moderate to firm pressure with the handpiece oriented horizontally, place a pulse. Then move up 100% from the first pulse and place the next pulse. Continue this pattern until you reach the lip. Go back to your starting spot, move over 50% the width of the treatment area, and repeat the pattern until the chin is fully treated. This is your first pass. For pulses to the brow, place ultrasound gel on the upper brow skin, ensuring treatment outside of the orbital rim. You can use the weight of the handpiece to provide traction to gently pull lax skin onto the brow bone and place pulses here. In review, the mechanism of action, the tissue coverage, and the pulse placement and pass pattern remain the same with your original lift applicator. The difference in the precise applicator versus the lift is merely the number of transducers, so you as a provider can maintain appropriate tip-to-skin contact in difficult-to-reach treatment areas. Your Sofwave clinical team is available for questions, as are your local sales representatives. Thank you for your attention today, and we look forward to hearing of your successes.